my head around why moderate intensity exercise had no effect, but so be it, that was the observation. In a study I wanted to show some of Steve Boucher's work right here from Sydney. They don't equate the volume of exercise in these two groups, but they get an observation here that's very similar to the study I just showed you. This is change in central abdominal fat by DEXA. And strangely, in these studies, you get the high-intensity groups reducing, and in the steady-state exercise, you get observations that I've never seen before. They go in the wrong direction. But sure enough, if you look at the sole metabolic variable here, the change in fasting insulin was also consistent with high intensity. So in the short duration, very small sample size, randomized trials, we get what we just showed you there. In some of the larger trials, and here I use almost exclusively the work of Bill Krause. I know Bill Krause is at this meeting, and he and his group deserves a lot of credit. The STRIDE studies have schooled us a little bit in this particular area. A little bit trickier design than controlling for volume per se, but they do the equivalent mileage here at two various different intensities. So this is their low moderate, and this is the low vigorous, and it's these two groups that I'm particularly interested in here. Much larger sample size, as you see here, and a 6-month duration. And what you see here is something very similar, that if you look here at the low, moderate intensity, low exercise, vigorous intensity, you get essentially no difference between those groups. In the high volume vigorous, you do get a trend towards greater changes, but in fact they were not statistically different, perhaps underpowered. But again, you might argue that the clinical significance anyway is not very much. And in fact, when they look at the metabolic syndrome, a very interesting observation, they find that the low moderate intensity exercise group has benefit by comparison to the vigorous exercise group. And in fact, that's a principal conclusion in this paper. So here you get observations, larger sample size, slightly longer duration, completely opposite to what I just showed you. In a similar study done by Joe Homard using similar data from the STRIDE study, in fact, if they look at insulin sensitivity, they get the exact same thing, that the vigorous group, in complete contrast to what I just showed you in the small sample size study, short duration, that they get a much different finding, suggesting that moderate intensity might be the way to go. Finally, the last study that I have time to share with you is a little bit different, but it's such a brilliant, well-done study. I just love showing it. It's done by Barb Nicholas's group at Wake Forest. Now, I will point out that in this particular study, they look at exercise intensity. They equate, the volume of exercise in the two groups, but they do also prescribe a negative energy balance using caloric restriction here. But they equate that in the two groups. And what I found particularly nice here, 5-month study, they prepared the diet and provided it to all the participants, all the exercise under supervision. I think this study is about as good as you can do it there. So great credit to that group. I'm showing you the exact same thing here, just to point out slightly larger sample sizes, very low loss to follow-up. This study, very well done, excellent study, I think. But the bottom line, absolutely no difference. If you look at weight, waist, or visceral fat here, there's no trend, there's no difference whether you expend energy moderately or vigorously according to their findings. Now, they did find a difference in terms of lean mass and VO2, and those may be outcomes that you're particularly interested in. But in terms of adiposity, total or regional, absolutely no difference. So by way of a summary, in the very short time I've had to share with you, and I apologize for having to go so quickly. I think right now, if you take a look at the trials that we have to look at that are well done, controlling for the factors that I've shared with you over the last few minutes, I just don't think we can firmly say either way that high intensity exercise is conferring a benefit, even though some of our own work cross-sectionally may have shown that. So my interpretation from this at this point is the following. I think these are positive outcomes. I don't know if this is true. Time will tell. We're doing a major study right now, 300 people randomized, in about 3 or 4 months. We'll have some more information. But to me, this is a win-win scenario. You can offer two options to individuals to get benefit. In other words, there's certainly nothing wrong with doing vigorous exercise. If time is your enemy, then perhaps that's the medicine for you. So I'm asked this question repeatedly now, especially when I speak to clinical audience. Should I exercise 45 minutes fast or 30 minutes slow? And I give you the same answer that I give them or anybody else that asks me. That's my answer to the question. I'll stop there. Thank you.
Thank you very much. Any items of clarification or very quick questions?
What about mental health outcomes? Do you know much about that?
Not in these trials. We have benefit of exercise, but I don't know of any trials looking at different intensity. There could be.
We might come back to that because I know there are some people in the audience that probably do know the answer. So in the general discussion, we'll pick that up. Thanks, Nick. All right, thank you very much. Now, it's my great pleasure to tip the energy balance seesaw in the other direction. And we have two discussants to talk about what we've just heard. The first one is Peter Kaczmarczyk, who's a professor at the Pennington, I have to get the name right here, the Pennington Biomedical Research Center in Baton Rouge in Louisiana. But importantly, he holds the Louisiana Public Facilities Authority Endowed Chair in Nutrition. So I'm not sure whether we're going to get a completely different point of view from Peter, but let's hear it.
Okay, well, yes, it's a pleasure to be here, and I'd like to thank all three speakers for their very clear, on-time presentations, which is very rare in this group. When Wendy asked me to do this, she suggested, rather than just summarizing what we'd heard, that I could add a little bit of context and show a couple of my favorite slides, perhaps. So I would like to do that, and it turns out it meshes very nicely with what we've heard today, and earlier in the conference, trying to put things into a longer time perspective. And we understand that energy, both energy intake, energy expenditure, and energy balance, have been central selective pressures throughout human evolution, throughout hominid evolution, throughout evolution in general. These are selective pressures placed on populations, and we have to look at it within that context of where we are today in 2012. This is one slide going back a few years, looking at changes in BMI over the hominid evolution from Afarensis to Africanus as we become, we have evidence that from Lucy moving forward that we became more robust as a hominid line, and then as the emergence of Homo, we became more gracile. In other words, as we became smarter, we didn't need to be as strong. And this has changed quite rapidly in terms of human evolution from the 1860s through to today. Now, I probably shouldn't be showing this. I didn't get IRB approval from some of these, or informed consent from some of these other individuals, but I think they grandfathered that info. So when we look at evolutionary pressure on the hominid line, this idea of energy balance has been very strong. And we know that in Africa, during the time of the emergence of the Homo lineage, there were great ecological changes going on, which forced us as hominids to increase our ranging patterns, increase our home range, our foraging patterns. We saw increases in body size, and these both led to increases in total energy expenditure. And this gets at what Dr. Blair was talking about, and Dr. Hand as well, regarding the idea that larger bodies require greater energy intake. And the increase in diet quality has a negative impact in terms of energy expenditure as well. So within that contribution, as humans, we're very efficient. When we talk about energy balance and evolution, there's been a drive towards greater efficiency at extracting as much energy from the environment as we can with as low of an energy cost as possible. And that's one of the reasons we stood upright back in the days of Lucy in the sky with diamonds. So why be active? Well, yesterday and today, looking back, we were acquiring food, acquiring shelter for escaping predation. Obviously, the saber-toothed tiger was a big problem for us. So these are reasons to be active. Procreation required a lot of activity. If you look at the squirrels around Sydney, you'll see that there's a lot of activity in the springtime. Today, we have different reasons to be physically active. You don't need to be active to acquire food today, to acquire shelter, to procreate, to escape predation. But today we do it for enjoyment, for a few rare individuals. We do it for the maintenance of body weight. If you ask people why they're physically active, that's a very common answer. For occupations, we still have active occupations which require massive amounts of energy expenditure, and also for the prevention of chronic disease. As we understand, people are physically active for their health. So for 99.999% of our evolutionary history, the focus has been on maintaining that energy intake side of the equation, which causes us to have higher levels of energy expenditure. But today, we use physical activity to offset our energy intake. And I think that this kind of selective force that we're working against in terms of dealing with the obesity problem is something we need to keep in mind. And we have evidence from some studies, and much more now since this has been published, that humans, as free-living mammals, have low active energy expenditure to resting energy expenditure rates. The groups on the far end, I don't know what point over here, this is the mean of all free-ranging mammals, and these are a number of different human studies done in non-athletes, the rural population, military even, and among athletes. And the only time we get up to the level of free-ranging mammals are in Swedish and Finnish cross-country skiers. They have massive amounts of energy expenditure, so our friends right here know what I'm talking about. And so we're faced with this issue of sedentary behavior. It's ubiquitous in modern society, but it's as a result of our drive to be more efficient. That's very hard to shake. We just have iPads and iPods and all these things. We have televisions, computers, we drive everywhere. And it's this drive to be efficient, which is what we're constantly fighting. Not just as a society, as a behavioral choice, but it's going against our evolution to be physically active, just for fun, because it really is ingrained in our physiology to be inactive and to expend as few calories as possible. So with that, I guess, what do we do now, Wendy? I guess we have another speaker. Okay, well, thank you for your attention, and
So what we are going to do now is have another discussant, and then after that, I'm going to get all 5 of them to come and sit up here, not on 3 chairs, we'll have 2 more chairs, and then we'll open up questions both from you guys to the panel and between the panelists and the discussants. But before we do that, I'd like to introduce Professor Berit Heitmann, who's come all the way to us today from Denmark, from the, let me get it right, the University Hospitals of Copenhagen, where she's a nutritional epidemiologist. So I think we'll have a different view again. Thank you very much.
Thank you very much. Now, Stephen said that we need to understand energy balance better. And I was very happy that Gregory pointed out the complications or the variations and the different components that go into energy balance. Because in essence, essence, the energy balance equation is really just a descriptive phenomenon. It's reflecting, of course, the thermodynamic laws, which of course are always true, but it's basically a very simplified version that we then apply to the human body. And I was very glad that Gregory was pointing this out. So the energy balance equation, of course, is always true, but it's also purely descriptive. There's nothing causative about the energy balance. Now, I want to draw your attention to the Laval overfeeding twin studies. As some of you may know, these were studies that were conducted among NC twin pairs. There was 24 men, 12 NC pairs, that were housed in a closed section in a respiratory chamber under 24-hour supervision by the staff. In this group, physical activity and energy expenditure was held constant, and all men were subjected to a positive energy balance corresponding to 1,000 calories per day. Now, they were subjected to this for 100 days. They were allowed outside the chamber 1 day per week, but in total they were subjected to an excess energy balance corresponding to 1,000 calories per day for 100 days. Now, what happened was, and this, what this picture shows is the change in body weight for one twin and the change in body weight for the other twin. And what you can see is that there's a very big variation. Some twins only gained about 4 or 5 kilos, whereas other twins gained 12, 13 or 14 kilos. What you can also see is that the variation between twins within a pair was a lot less than the variation between twin pairs. So you may say that these guys up here, they responded more to the overfeeding than the guys down here. So there was a big variation in between how people reacted to this energy balance overshooting of 1,000 calories. So what was also interesting from this protocol was that the weight gain that they attained only was about half of what could be calculated. But in fact, some of the people, these people up here, gained more than what would have been anticipated by the calculated excess energy they received. Whereas these people down here gained a lot less. But as a general phenomenon, only about 50% of the anticipated maximal weight gain was attained. So the data demonstrate that some individuals are a lot more at risk than others to gain fat or gain weight in a positive energy balance. And this, of course, is about influences of genetics, that within the twin pairs, because they were monozygotic twins and share their all genes, within a pair there was not genetic differences, but between pairs there were big differences. And these differences were telling us whom would gain weight and whom not, although of course we couldn't from as a stand saying which of the pairs would gain weight and who would not gain weight. And more interestingly, when the weight gain introduced by overfeeding was stopped, and when they weren't overfed anymore, they attained the same weight level after some time that they had prior to the intervention. This is another example that I thought I would share with you. This is some old Danish data. This is from the Danish Adoption Registry, data published back in the 80s. What it's showing is the mean body mass index of children that were adopted away at the age of just being born or in the first weeks after birth. And what is shown down here is their weight class, thin, medium, overweight, and obese as adults. Now what's up here is the body mass index of their parents. And what you can see here is the body mass index of their adoptive parents and the body mass index of their biological parents. And what you can see is that there was absolutely no relation between body mass index of the adopted children and the body mass index of the parents in the family they grew up with. So you might say that there was actually no influence of behavior from the adoptive family, whereas there was a very strong association between adoptee weight class and biological parents' weight class, despite the fact that these individuals, apart from being born by the biological mother and having some input very early on from the father, had no contact with their biological parents. So I'm showing you this because I think it's important when we understand energy balance, first of all, that there are some strong components that we might have to consider as well. And second of all, that the level at which we reach energy balance may vary tremendously. Also, I'd like to say that when we look at observational studies or interventional studies, there's really not much evidence from any of these type studies that either physical activity or excess energy leads to obesity. And it's very important, I think, to not translate what we see in obese people who undergo weight loss into what is happening in the normal weight individual who are about to gain weight. And from studies, both of interventional and observational nature, there's generally very little evidence that energy or physical activity is related to weight gain among normal weight individuals. Also, we see, as was also pointed out by the previous speakers, very big variations both in physical activity and in energy intake during days. But even though we see this, most individuals will keep a very stable body weight at long periods and will only gain weight at a very, very short, slow pace. For instance, the daily surplus of energy that is accumulated on the body is tiny and usually less than 1% of total energy turnover. In an adult Dane, at least, that's about half a kilo a year. And even if we can measure what's happening over a year, we cannot measure energy intake, energy expenditure, or even the excess energy that we use to put fat into the tissue. We don't have tools to measure that on an individual daily basis. Right. I think that's more or less what I wanted to say, and basically what it comes down to is that I think energy balance, although of course always valid, it may not be the only thing that we need in order to move somebody who's natural weight into overweight. It's not just burning more calories or eating more calories. Thank you. So what I'd like to do now, you can stand if you prefer to stand, and then you can move to the microphone. I heard somewhere in this conference that standing was better for you than sitting. What I'd like to do is see, first of all, if any of the speakers would like to ask a question of the two discussants, first of all. Is there anything burning from Rob or Steve, Greg, that you'd like to ask of Berit or Peter?
Yeah, let's hear what the audience says.
Okay. I just wanted to check that you weren't going to respond to what they said. Because I have some questions later. Okay, let's
say that they were wrong or something.
Yeah, you can tell them they're wrong. All right, well, let's open it up to the audience then. If you could please come to the microphone, because it's going to be very difficult in this room to hear otherwise. Are there any questions? Okay, well, I'm going to start then, and this will get the ball rolling. We have, in Australia, a longitudinal study of, let's say, 20,000 women. We've been following them now for 15 years. And they're in two age groups, basically, young women in their 20s and middle-aged women in their 40s. Let's take a 10-year period, over 10 years. Let's focus on the young group. So lots and lots of women, aged 20, moving through to 30. Their average rate of weight gain is exactly what Berit said, 0.5 kilogram a year. So in 10 years, it's 5 kilos. In 20 years, it's 10 kilos. Okay? This is happening, we have the data. But half of them are not gaining weight. So the other half are. The ones who are not gaining weight are largely the ones with healthy BMI at baseline. The ones who are gaining weight are already overweight at baseline. So their rate of weight gain is actually 1 kilogram per year, as the average was 0.5 kilogram. I hope I haven't lost you. So the average of those who are gaining weight, the average rate of weight gain is 1 kilogram per year over 10 years. Now that to me spells energy imbalance. Would any of you please like to tell these women of Australia, advise what they should do to prevent this weight gain? Go on then, Peter. Come on, tell us what they should do. Moving to Denmark won't help. Their average weight gain is the same. Well, we have an obesity pandemic here. We have weight gain. We have to be able to advise the public what to do. But it's only half of them gaining weight. And sadly, it's the ones who are already overweight in their early 20s who are gaining weight faster than the ones who are normal weight. So I heard some explanations for that. But I want to know, what do we tell these women to do? We have to stop weight gain. We know it leads to chronic disease. So Steve, what would your advice to the women of Australia be to prevent a weight gain of 1 kilogram per year?
Well, of course, be active.
Be how much active? How much active?
The increase in weight in chronic disease holds true only if you either ignore physical activity or measure it poorly. Or maybe not measure at all and don't take it into account in the analysis. So some people are more likely to gain weight than others, and I guess I'm not too surprised that there's variation on that particular characteristic. As many of you know, I ran it for a long time about fitness and fatness, and at least well up into class 2 obesity, there's just really not much evidence of health risks if you are active and fit. So I'd say be active and fit and don't worry so much about the weight.
It's a reasonable question, and of course an important one. And if we had the answer, we wouldn't be here, what to tell the people. But I think there's a few things we do know. That in the environment in which we live, and Peter and many at this conference have referred to, there's strong environmental forces acting against major changes in behavior. It's just very difficult. I know of no good randomized trials that over 3 or 4 years have been able to sustain these major changes in activity. So I would do 2 things. First, I would do what Steve and I and many people in this room have been saying, dissociate the behaviors from the weight outcome. That's the first thing I would do, that there's so many benefits in terms of consuming a balanced, healthful diet and being active that have nothing to do with weight. So that's the first thing I do. And then the second thing I do is I'm becoming more and more a proponent of sort of Jim Hill's and America on the Move thing, where maybe the small changes is the first place to start. Maybe just 100 calories a day or 200 calories a day in any form. Give it to me in increased physical activity or decreased energy intake. But let's see if we can at least do that, and by doing that, maybe prevent further weight gain. Now, that's fine for me to say. The trouble is to try and convince men and women who want to decrease by 45 pounds by Friday that's a reasonable outcome. But I think the evidence would support that type of an approach. Whether can be sold, time will tell.
Okay, so I guess there's two issues. One is prevention of weight gain, the other is weight loss. So very clearly, the energy gap in Australian women is coincidentally 100 calories a day is what we've calculated. So our advice has been, published in that well-known journal called the Women's Weekly, to cut out the Tim Tams. We have a biscuit here called a Tim Tam, and it's about that big and it's about 100 calories. So we use it as a kind of cut out the Tim Tam. So that's very different from weight loss. But I think it's a good, thank you for introducing the small changes idea, because I want to come back to that. But Berit, do you want to say something, and then I'll take a question on the floor.
I think it's interesting that there has possibly been hundreds of observational studies, and not as many interventional studies, but many studies failing to show an association between, as I said, physical activity and weight gain, or energy intake and weight gain, moving normal weight people from normal weight into overweight. There's absolutely no clear evidence for that. Now, where we do find strong evidence is in relation to insecurity. This is a very consistent finding coming up that children, adults as well, most studies have been conducted in children who experience insecurity gain weight. The differences we see between social classes, there's a huge difference in obesity occurrence between social classes, can to some degree be pinned down to insecurity. So whatever happens in the body with insecurity, whether the fat cells get primed to absorb more energy from the diet, we don't know, but we do see this consistently. So maybe we need to consider shifting paradigm a little bit and stop just thinking about diet and physical activity as the only causes of obesity.
Thank you. Steve, did you just answer this question?
I would like to respond. Baron, I'm afraid I do have to disagree with you. I think there are a number of large studies with showing that people who are active do not gain weight or do not gain as much weight. I mean, we published one where Pietro was the first author. What's the study of the young Americans, Cardia?
Yeah.
Cardia. Cardia showed that fairly convincingly. I'm sure you can find some that don't, but I think if you look at studies where activity's been measured fairly carefully, those who are more active are not going to gain as much weight over time.
I have to say that in our study, physical activity, energy intake, and sitting time are all implicated in weight gain, and socioeconomic class is not, because it's very difficult in Australia these days now to tease out exactly what socioeconomic class is. If we look at occupations, the ones that used to be down the bottom now earn a lot more than I do, but they have a much lower level of education. I'm talking about our miners and tradesmen and people that have generally do not have a university education, but they're earning a lot of money. So we're getting into some difficulties with defining these issues. But in our study, certainly physical activity, energy intake, and sitting time are associated with weight gain. But actually the most important predictor of weight gain in our study is getting married and having a baby. So when people get married, they change these behaviours, and when women have babies, all sorts of things change. So it is more complicated than just physical activity and energy intake. But there was a question from the audience, Sylvia.
Silvia Tietze from Austria. When I was listening to your presentations, I drew the conclusions for myself. Maybe we have to tell people not either moderate or vigorous intensity, but to say you have to do both moderate and vigorous intensity physical activity. But in our physical activity recommendations, we separate them typically and say you can do a combination of both. Is there already some evidence to say maybe we should, in the next recommendations, tell people do both moderate and vigorous intensity physical activity?
What? No?
I don't think maybe some of the panelists will disagree. I don't think we have convincing data to say either or right now. I think that's the evidence that I looked at. I think that pragmatic approach, as many will say, and we've seen this in our own trials, is that high intensity exercise in our own trials that we're doing right now is associated with the highest dropout rates in our interventions. I know if Bill is here, Bill Krause, I know for a fact that in the STRIDE study that the high intensity was the largest dropout group. That's not to say if time is your enemy and you want to do high intensity exercise. I think it's going to be up to the individual. But I know of no data that says right now one or the other or a combination is better. They quite frankly, they both seem to be equally effective.
I think there was a paper somewhere in the conference that said you should ask people what they like to do.
Yes, the best exercise is the one you will do regularly. But if you attended Ken Powell's lecture the other day, he had that beautiful slide. Instead of looking at sedentary, light, moderate, it was, how do you go, that the colors faded into one another, right? Kind of a rainbow. So I think it would be a mistake for us to continue to focus too much on these artificial cut points that we've done. And we do need to look at the sedentary and light as well as moderate and vigorous.
Thank you. Could you please state your name and...
Yes, absolutely. Colin Chen from NIH, Bethesda, Maryland. My question is actually for Gregory. You showed the metabolic data. I just can't let that go. I'm sorry. The resting metabolic rate, you said there was no association with fat-free mass, or weak association with fat-free mass. And this is actually quite surprising. Many studies we've done, and pretty much everyone else has done, have showed a strong correlation with fat-free mass. Why do you think your data is showing association with the fat mass and not fat-free mass?
I knew if anybody asked me that question, it was going to be you. I don't know. We certainly aren't the first to show that there are associations with body mass other than muscle. And I know that's been the dogma for many years, but certainly, we aren't the first to show that. I don't know. As we talk about these kinds of questions, I always come back to, if you consume more calories than you expend, you're going to gain weight.
No arguments there.
If you do it by trying to limit caloric intake, you'll lose weight. I mean, diets work. If you do the diet, it will work. The problem is that you're going to lose muscle mass.
Compensation.
You're going to lose resting metabolic rate, and you're never going to get it back. It's just almost impossible to get rest after you've lost weight over time, especially yo-yo diet. It's very hard to get your resting metabolic rate back to where it was before. The question you're asking me, I don't have an answer for that. In fact, we were all very surprised to find that.
If maybe go one step further, so I also question why you present your metabolic rate per kilogram body mass, because when you do that, there's a well-known phenomenon called non-zero intercept, and you actually are biasing your sample in such a way that data may not show what you really think that they ought to show.
Well, I actually showed both absolute and relative. And what we see with the absolute, of course, is that it's related to mass. The heavier you are, the more higher the caloric consumption at rest.
Right.
If you do what we do as physiologists, which is try and adjust things per body weight, to try and put everybody on an even scale, you see exactly the opposite thing. The most active people, the leanest people, are the ones with the highest resting metabolic rate. It's the exact flip.
Okay.
So that's why we did that.
Thank you.
Okay, maybe we need to discuss that.
Please continue your discussion afterwards. Next question. Thank you.
I have a question for Steve.
Could you say your name and where you're from, please?
Art Quo from University of Michigan. I was completely convinced by what you said about the importance of physical activity, but I was struck by the comments about the change in food intake, because I feel like hasn't the thermic effect of food changed a lot in the past years? And just speaking for myself, I feel like I have a second brain that I have no control over. And it seizes my hand and steers it away from celery towards the French fry. And it's because that second brain has calculated how much effort it takes for me to digest and chew and all of those things. And that's what's steering me there. Not just the flavor that helps, but I feel like that's a huge part of what guides my poor food choices.
Well, I'm certainly not an expert in these areas, but we have been digging into the literature, and I don't think we have any evidence that the thermic effect of food has changed. I mean, there's still a range. Now, whether some of the things you mentioned may influence that, I mean, I think that's a very good question. Maybe we'll have data that will bear on that issue. Again, remember, we're repeating these measures every 3 months, and there are flaws in any measurement you take, but maybe we'll have information that can address that a little bit. And again, Greg is just cringing, afraid of what I'm going to say next, because he's the physiologist, neuroscientist, and I know you want to add anything to it.
I think one of the most fascinating parts of studying energy balance and weight management, if you look at the GWAS studies that have come out over the last few years, the two things that are coming out of that, first of all, that the genetic pieces that we can uncover, very tiny effect size. The second thing is almost all of the genetic changes that we're finding that are related to obesity are behaviorally related. They're related to either endocrine function, feeding back to the brain about the size of adipose cells or the amount of food that's in the gut, or they're related to reward systems in the brain. So when you talk about you have a second brain that's actually driving you towards something that you don't really want to do, you may not be too far off with that.
Thank you. Now, we're going to have one more question, because I think I can... Aaron, have you got... Is there a question back there? No? All right, one more question, and then I'm going to introduce you to Eric. The Australians are probably saying, oh no, not Eric.
Elaine Rash from New Zealand. I just want to ask the panel about the intergenerational effects of fatness, particularly looking at the epidemic we have now of gestational diabetes. And it is associated with larger mothers having larger babies, and so the cycle goes on. And that, to me, is one of the things we should be looking at, is trying to prevent that from impacting so much on children as yet unborn.
Eric, would you like to try that one? Do you know anything about gestational diabetes?
I think you're right. It's certainly a problem, and
Could you go a little closer?
Yes, and I think what you are also talking about is epigenetic phenomena that may not only affect one generation, but may actually be inherited into the next generation. So intergenerational effects, not only for diabetes and for heavy mothers getting heavier babies and getting gestational diabetes, and what influence that might have on the offspring long-term health is a very important area. Although I think we know at least too little to intervene towards the mechanisms, but we do know that it's important to prevent that mothers are obese when they give birth or enter pregnancy.
Okay.
As the oldest guy, can I have the last word? What I want is for us to actually have better data. That's why we're doing this study. I want to stop the nonsense out there in the blogosphere that just goes on and on and on about whether it's this crazy particular food or that crazy sitting on your rear end, whatever it is. Let's get better data, because we do not have it. And to get the neuroscientists involved, get the social science, we've got to do this. And let's stop the nonsense and get serious about the science.
Thank you. That seems like a good statement to finish. I'd like you to just stay for a minute if you'd like to be introduced to Eric, but before I bring him up, I'd like you to thank our 5 speakers, and the 5 speakers sit down so that you can see.